Good afternoon. I'm Harold Cox from the School of Public Health. We're here today because 17 people were killed in Florida. We're here today also because 49 people were killed in Orlando. We're here today because there were 17 other people who were killed in Blacksburg, Virginia. And then on a regular basis, there are individuals who are either killed or who are injured from gunshots. And it becomes very important for us to then reflect on the importance of thinking about this issue and to think about what does it mean for us to have this kind of violence on a regular and routine basis in our country. And what are the kinds of things that we need to do about it? Today is a conversation. And it's a little different than the kind of conversations that we usually have. Usually when we invite you to a room like this, we have people who come up and he'll give presentations, and then you sit quietly and listen attentively, or sleep sometimes maybe. This is a little different because you are the people who are going to be talking with us. This is a community forum. We're interested in what you think about what the issues are for you. What are the things that are on your mind? What kinds of areas do you need clarification about? What is it that you think that we should be doing around the issues of gun violence? It's a conversation about you. And we're going to be facilitating that conversation with a group of experts. But before I get to them and have them to introduce themselves and tell you a little bit about why they are here, I want to tell you the other reason that we're in this room. It's because Jess Sines and Jada Fleshman came to our offices fairly recently and said, this is an important issue and we need to do something. It's very important to hear from our students about the kinds of things that are important. And now we have two and many others who are also saying it's important for us to do something. So perhaps the best way for us to start this program is to let you hear from the person who encouraged us to do this program. So please meet Jess Sines.
Hello, everyone. Thank you so much for being here today. Panelists, thank you so much for your time. People in this room, I want to actually thank my comrade Jada for sending a text message and saying, Jess, we have to do something. And so something we did. You know, we organized a very thoughtful email to a handful of humans, and within 24 hours, we got a response back. And I'd like to thank the Activist Lab and Anne for emailing me right back and saying, Jess, you know, your finger's on the pulse with this one, let's do something. And so we had a conversation, and we came together, and we talked about, you know, what was realistically feasible, given that we sent the email about a month ago, and this is what's come of it. And I'm very proud to say that the School of Public Health definitely stepped up to do the social media aspect of it, and all of the humans that I've seen participate in it, I was very surprised, pleasantly so, that even in spite of the weather, people were out there at the march today, and having their voice heard. So let's continue this conversation, and I hope everyone gets a little something out of this community forum. Thank you.
So to begin this conversation, it's important for you to know who are the people who are going to help reflect on the things that you are going to talk with us about. And what I've asked our panelists to do is to just give us a very brief introduction about, one, who they are, and why they're on this stage, and why in particular this issue is important to them. And I'd like to start down at the end with David Jones.
Excellent. So first of all, thank you, Dean Cox, and everybody who made this event possible. As I was reflecting on what we're doing here today, I find it a remarkable privilege to be part of a community that is tackling such difficult issues head on. And I think it's really fantastic that we're doing this. So I'm a political scientist studying the politics of health reform. So I'll be honest, I feel a little bit intimidated today in that my sort of expertise isn't really about guns per se and gun policy per se. But as I have come to understand this issue better, it's become clear to me that this is absolutely a public health issue. And one story that for me really illustrated the public health importance of gun safety and gun violence has been through my research in the Mississippi Delta. I'm writing a book about health in the Mississippi Delta, arguably the least healthy place in the country, trying to understand how the social determinants of health, education, housing, public safety, and so forth work together to facilitate or inhibit good health in a single place. And I've run focus groups with people, interviewed lots of people who live in the Delta, and hear lots about how hard it is to eat well when there's no grocery stores within 45 miles, there's no doctors anywhere nearby, we can't afford insurance. But I think particularly about a conversation I had in a church about a month ago in the city of Clarksdale, where people said, you know, the murder rate here is literally 10 times the national murder rate. You know, a town of 16,000 people having 12 murders a year is 44 per 100,000. I mean, it's the second highest murder rate in the country. They say it's sort of impossible to think about eating fruits and vegetables when you're hearing gunshots on a nightly basis. And it's just the stress that the chronic and toxic stress from gun violence in their community just overwhelms any other public health message we have. And so that's why I'm here.
Thank you, David. Mike.
So I'm Mike Siegel. I'm in the Department of Community Health Sciences. And I guess about 6 years ago, in 2012, I was happily doing tobacco research and kind of celebrating the victories that we had in tobacco control and kind of thinking, okay, you know, I can actually retire pretty soon at the young age of 35. And then Sandy Hook happened. And I grew up in Danbury, which is the town next to Sandy Hook, and had a number of friends who went to Sandy Hook Elementary School when I was a kid. And so I definitely wanted to do something about it. So I pulled out my checkbook, and then I realized I don't really have any money. So I felt really bad that I couldn't make a substantial donation. And then I said, well, what do I do well? And after about 30 minutes, I thought of one thing, and that is I know how to do research. And so at that point, I said, you know what? I'm going to shift my research, and I'm going to start researching firearms, because that's something I know how to do. And it's one way I can make a contribution. And so over the past 6 years, I've been delving into the area of firearms violence prevention research. And the focus right now has been in a couple areas. One is looking at state firearm policies and their impact on gun violence. As you know, there's many, many different policy approaches that are being discussed, and there's not a lot of research out there to kind of indicate what policies are effective. So we're looking at different types of state policies to see whether they're, you know, which are effective, and if so, which ones have the greatest impact. We're also looking at racial differences in homicide and what are the factors that influence the tremendous racial disparities in firearm violence. And then finally, we're looking at gun culture, trying to get a better understanding of what gun culture is and what its relationship is with homicide, and if there's any hints that come out from that about what we can do to more effectively curb gun violence.
Thanks, Mike. Zamin.
Thank you. Thank you for coming here today. It's a warm day, and I feel very warm to see really a big crowd of people. I feel very encouraged. And one of the reasons that I participate in this line of research is primarily this is my research focus. I'm very interested in social determinant of health, particularly policy determinant of health. And the reason is that policy is one of the areas that we can make modifiable changes. And they are also actionable drivers that can change population level risk to our society. I'm less interested in biomarkers. Not that they are not important, but they're hard to change. But in order to advocate policy change, we need evidence. And that's what I have been trained at, to get that good evidence. And firearm violence is one of the areas that desperately need evidence. We have seen a lot of debates. We have seen a lot of sound bites. We have seen a lot of actions because of the heat of moment. But it's not guided by light, by the light of the event, by science. So I think this is an area we together can make very strong step forward to do more research. And I have done a lot of research in alcohol policies, and alcohol policies particularly among underage drinkers. But as I delve more into underage drinking, I found that when youth are under influence and have access to lethal means, the risk of fatality would escalate tremendously. So I want to spend more time to do research, particularly among policy determinants on youth health. And that's what drawn me to this research. And I've been very privileged to work with Mike, working on gun policies to understand what policy works more effectively and what policy are not working well. Because to do what we should do, we also should not do what we should not do.
Thanks, Zaming. Michael.
I'm Michael Ulrich. I'm in the Center for Health Law, Ethics, and Human Rights, which means I'm a lawyer, so I have a slightly different viewpoint than my colleagues up here. But I was a student during Columbine. I remember the year anniversary coming up and my parents trying to decide whether they should allow me to go to school or not. I remember friends trying to decide if they were going to go. And I was an MPH student during Sandy Hook. And it was sort of the similar feeling of shock and sort of, outrage. And then it kind of died down. And I think it was shocking because Sandy Hook had, young children involved, people thought that was kind of be the turning point, and it didn't happen. And so I graduated, and I, like everybody else here, wanted to figure out what can I do, where sort of my skills can be used. And with a relatively new constitutional right, the Second Amendment, the right to bear arms, it's relatively new, though the Second Amendment's been there since the founding. It wasn't until Heller that it was really decided this is an individual private right. And so what does that mean then when that individual private right starts to affect the health of the public? And as a public health law researcher, I thought, well, there are other areas where we've seen this. We've seen this in other areas of constitutional rights. So what does this mean for gun rights? And really that's sort of what I've been working on the last couple of years, is trying to figure that out. Because really when it comes to constitutional rights, you have constitutional law scholars who provide a lot of insight, but they don't necessarily look at health and how those rights impact health, whether that matters, should it matter in determining regulations and restrictions on those constitutional rights. And so I'm trying to sort of start the movement of health law scholars becoming more involved in this particular area.
Thank you. Sure. Valentina.
Thank you, Dean Cox. My name is Valentina Vega. I am an MPH candidate here in the Health Policy and Law Certificate. In my previous life, I was a legislative aide for constituent services in the state of Virginia. So I did a lot of the advocacy on the other side. I took a lot of the phone calls, especially that when you have an organized group and people start calling, I was the one on the other side giving the information and letting legislators know what people wanted and how they wanted the votes to go. So I'm happy to be here to answer any of the questions, and an honor to be sitting beside my professors, so thank you.
Is that a good thing, sitting next to your professors?
It's nerve-wracking, yes.
Nerve-wracking? That's why I put you on this side here close to me.
Both of my professors.
Oh, yeah, well, all right. Well, okay, I can't do anything about that. So here's what I need you to do. I need you to start thinking about what are the things that you want to talk to us about. What's on your mind as you think about this issue around gun violence? What are the issues that are important to you? I also want to let you know that in very shortly from now, we're going to do an exercise in this room that I've never done in any room before. We're going to do some phone banking to legislators in this room. And we're going to give you some instructions on how to do that. Now, when we've talked about this, we don't know exactly how it's going to work, but I'm an adventurous kind of guy, and so we'll stay tuned for that. But I'm interested in knowing what's on your mind. What are the things as you think about guns and gun violence and gun safety and gun control and the variety of different ways that we classify this issue? what's the thing that's on your mind? And while you were thinking about that, and there are microphones that will be teed up that will assist you, I'm just going to ask our panelists, while you're thinking about your issue, one of the things that we've talked a good deal about is the Dickey Amendment and the problems that come as a result of not being able to do research. And I think there's a lot of misinformation about what that means, and also it causes a problem. And I'm wondering if you can help us understand, so what is it? What are the limitations? What can we do? What can we not do as a result of the restrictions that have been placed on doing research around guns is paid for by the federal government?
So my understanding from the legal point of view, though researchers might understand a little bit better when seeking funding, is that the main limitation is that they can't provide funding for research that would advocate for gun control. So it's not a strict limitation necessarily, but that sort of does it advocate for gun control or not is enough typically to essentially ban funding for it. Because you don't want to end up putting out research that could then fall under that category and have it be invalidated or something along those lines. So although it's not technically, by the letter of the law, an outright ban, it has essentially become one. That's my understanding.
So yeah, if I can just
Please.
if I can just add that the reason why obviously there's a lot of research that you can do in gun violence that doesn't actually advocate for gun control, because advocate means to take a position on a specific piece of legislation, and most of what we do in research is not that. And what it really amounts to is that the CDC, a succession of leaders at CDC, have basically been unwilling to stand up to the NRA. I mean, that to really translate this into what's really happened. And I understand why they did that, because they were afraid that if they did stand up to the NRA, they would lose their funding, that they would just cut all funding for CDC, or that they would make severe cuts in the injury prevention budget. But the reality is, in my experience in advocacy and fighting the tobacco industry and the alcohol industry, chemical industry, is that that's not the way it works. You don't make gains. I've never seen gains made by cowering down. I've only seen gains made by standing up and having courage. And so I think that the reason why, I'll be honest, the first person I ever saw in my lifetime that I was paying attention, who stood up to the NRA was Emma Gonzalez, 17-year-old. So. And so that's why I think things are different now, because somebody finally had the courage to stand up to the NRA. And I think that's what it really is all about, and that's what it's really going to take, is a willingness to stand up. And at someday, people will be willing to stand up to the NRA. These high school kids from Parkland are willing to do that, and until everybody else is, things aren't going to change.
Mike, you raise a really important issue around what it means to take a stand. And let's come back and look at that and unpack that a little bit more. But I want to turn to you, because this is a community forum. It's an opportunity for you. Make a speech if you want to. Tell us tell us what's on your mind. Tell me what you're thinking. Yeah. And I'm going to ask you, because we're recording, if you will use the mic, please.
Hi. Thank you all for being here. This is wonderful. Mostly for Mike Siegel, but anyone as well. Looking at how tobacco policy was eventually changed and how tobacco companies were eventually controlled. From my understanding, a lot of that came from the master settlement. That was a legal case filed against the top 5 tobacco companies. Are we at a time now when we could do the same thing for the gun manufacturers or the gun distributors? Or do we need more research to file that kind of case? Or do we need more political will to get into the court system on that? Because it seems like, as we've talked about, congressional action has not been coming at the rate at which we would want to see it for decades.
Well, one of the things that the NRA power has led to was an unprecedented piece of federal legislation, essentially a gift for the firearms industry. And Congress passed a law that's called the Protection of Legal Commerce in Arms Act. And basically what that law does is prevent any civil liability, civil lawsuits against the firearm industry. And this is the only industry that I'm aware of, other than the tobacco industry previously, that has that kind of unprecedented immunity from lawsuits. And so I think that in order to effectively be able to use this litigation strategy against the industry like we did with the tobacco industry, that law has to be repealed. It makes it incredibly difficult. There's only one kind of really, really narrow exemption in there that we can use, which is called negligent entrustment. And what that means is that if you can file a lawsuit based on somebody negligently providing a firearm to a person, knowing that that person is likely to use it for a crime. But that's kind of a narrow, very, very narrow exemption. It doesn't really, it's hard to see that being successful. And in fact, the parents of the Newtown Sandy Hook victims tried to use that, but the court said, nah, that doesn't cut it. So I think that law really needs to be repealed if we're going to use litigation successfully.
Thank you, Zev.
Hi, I'm Craig Ross. I have a question, I guess it's a two-part question. It's an epidemiology question and a political science question. So from an epidemiologic perspective, my understanding is that the number of people in this country who own the majority of guns is relatively small. I'm wondering if you have some statistics around that and what the potential impact in terms of number of people affected by that. That's the epi part of the question. Then the political science part of the question is more one of, if indeed this is such a small portion of the population, what are the strategies from a political science perspective that would be effective in trying to make change happen where sort of the tail is wagging the dog, so to speak?
Two-part question.
Does somebody know the epidemiology?
Well, I can answer the epidemiology one, and I'll leave the political science question. So in terms of the epidemiology, there's approximately 35% of people in the United States, of adults, own firearms. So it's not, and it's actually gone down substantially. It used to be almost 50%. So the percentage of people who own firearms has gone down, but the number of firearms that they own has dramatically risen. So fewer and fewer people are owning more and more firearms. That's the bottom line.
Yeah, so I mean, in the politics of this, I think one of the real challenges in thinking about how to deal with this is that, in my mind, the NRA's power is not really about campaign donations and money. It's the fact that we have a gun culture in America, right? And so the NRA giving money wouldn't matter if it wasn't tapping into something bigger in this country. I lived in Idaho for a while, and so I regularly try to channel how my friends and relatives in Idaho think about this. And, I don't think they're members of the NRA. I don't know, I haven't asked them that explicit question, but they sort of look to the NRA as a guidepost and where, they should feel on a particular issue and sort of slippery slopes that they're worried about. But I think the gun culture, the gun debate is much bigger than guns too, right? I mean, when candidate Barack Obama talked about people in the Midwest clinging to their religion and guns, it wasn't really about guns. It was sort of about something much bigger, liberals out of touch with middle America and sort of Western America. So how you break through that, I think, is a really hard question. But I think it's bigger than sort of just campaign donations.
So the idea of the NRA is much larger than just thinking about the issue of guns, that they are a vehicle that helps to shape opinions and then push those opinions out on a wide variety of different issues.
I think so. And guns tends to symbolize something bigger than just guns and hunting. And I think we can't ignore how racialized this debate is as well. I think a lot of the people I know in Idaho and the people I love in Idaho tend to think of the gun debate we're having maybe as inner city Chicago, maybe black communities in the Delta, and it's not really about them. Parkland isn't really about them in some ways. It's a very racialized, and if there is sort of mass shooting in a white community, it's mental health and video games are to blame.
Yeah. Yeah.
Yes, my name is Charles Lewis. I'm a fourth-year dental student here at BU. I guess have you guys seen any data linking gun homicide rates to gun ownership rates on a per-state level? I do know that gun ownership varies on a state-by-state basis, and different states have different gun ownership regulations, but I'm curious if you guys have seen any link between those two stats.
Yeah, so actually, Dr. Craig Ross, who asked the question just a minute ago, and I collaborated on a study that we published in the American Journal of Public Health a couple years ago, in which we looked at that exact issue. And we found that for each 1% increase in gun ownership, the firearm homicide rate goes up by about 0.9%, almost a one-to-one relationship. So in other words, if you have a state that has 30% gun owners, and then another state has 31% gun owners, the state with more gun owners will have a 1% higher homicide rate, which is a huge effect because, just so you know, the range of gun ownership in the US states ranges from a low of about 25% to a high of about 75%. And it might even be in, in Wyoming. So, so that's if you think about a 1% decrease for every percent that you go up along that scale, that's a huge, huge effect. And I should also just add that the percentage of gun owners has an even higher relationship with suicide. And in fact, in research that we are doing right now, we're finding that the best single predictor, if you want to predict the youth suicide rate in a state, the best single predictor is simply knowing how many guns there are in that, or how many people own guns in that state. It's an incredibly strong relationship.
So kind of a related question then is, would gun control result in fewer guns?
I don't know.
I mean, so there's an article in Vox this morning by Dylan Matthews sort of playing with this question and looking at other countries. So not just a state-by-state comparison too, but looking at other countries. And to get at the sort of the gun violence levels of other countries, we would have to have a lot fewer guns than we have now. Politically, I think it's impossible to think about taking guns away from people. And so I think we just have to, we have to sort of be willing to agree to more incremental changes and think, I think about this partly as we're fighting for my children and their children's generation too, right? I mean, you can't take away all the guns now, I don't think, politically, but you can sort of limit the future maybe.
Michael, you were beginning to think about this as well.
Well, we actually...
I was actually coming to the other
Oh,
Michael.
the other Michael, sorry.
Yeah. You will be Mike. This will be Michael.
Yeah, so I've read some stuff about it, and I've seen some comparisons about actually with abortion, right? And so the idea is if you make it burdensome enough to get an abortion, that will drive down people actually getting it. And so what about using that with guns, right? So the regulations don't necessarily say you can't have guns or you can't have any more guns, but you have a longer waiting period, you have to go through more training, you have to fill out more paper, things like that, and that might become burdensome enough to where, yeah, the extreme, person who, the small percentage that owns a very large percentage of the guns, it might not impact them, but then maybe you're shrinking down the percentage of the population that ends up owning some firearm.
Yeah. And now, Mike, you were thinking about this as well.
Well, I just wanted to mention that a couple months ago, Craig and Zeming and I, along with co-authors here at the school, including Dean Galea, published an article in which we looked at data that basically showed very clearly that when states change their laws to make it easier to obtain a concealed carry permit, their rates of gun ownership increase tremendously. there's a huge, actually a dramatic increase in the amount of weapons. So there's no question that gun policies do have a relationship with gun ownership. But I think what's even more important than that is who has the guns. Because gun ownership itself isn't necessarily a risk. The risk is who is it that has those guns. And what the problem with these concealed carry laws is that they essentially allow people with a history of violence to have access to guns. So I don't know how many people realize this, but in all but 14 states in the United States, if you have a history of a violent assault, that does not preclude you from accessing a gun, from buying or having a gun. In Massachusetts and a small number of other states, we actually have the good sense to basically say that if you want to carry a gun and you have a history of having committed a violent misdemeanor, you know that's disqualifying. You can't have that. So it's not just a question of how many guns; it's who are the people. And in 36 states, violent criminals who have been convicted. I'm not talking about arrested. I'm talking about convicted of violent misdemeanors. No problem with them walking around with guns.
Yeah. Yes.
Not to drastically change the subject, but I want to understand why there are protections for people to have assault rifles and magazines, to have so many rounds in them. I just I don't know, Las Vegas and the school shooting, I just don't understand why there are people. If you're hunting, why do you need an assault rifle? And I'm from Indiana, so I understand that mindset. Well, we're gonna go hunting. Why do you need an assault rifle to hunt? I mean, or a silencer to hunt. There's.
Thank you. Ziming?
Well, I think for people in this room, there's really no reason to have that. So maybe next time we should bring somebody from the gun industry to have a better explanation.
Sure.
So I think there is very big concern of why we should really ban large magazine assault automatic weapon. There's really no reason why we should have that.
I think I agree completely. There's no reason for this. The gun industry, I think, is very concerned that if you give an inch, then you sort of keep pushing. And so that they're really drawing a firm line. So we're not going to allow, we're not going to agree to any kind of regulations, which is, I think, why we don't have that.
Indeed, if we had someone from representing who had an interest in those kinds of guns, we might get a very different kind of response. But clearly from this group, you hear their particular perspective. Yes, in the back.
Mike Grodin from the Center for Health Law, Ethics and Human Rights. This is a question for Mike Ulrich. So what's the story with this?
Yeah, watch out, Mike.
So what's the story with the Second Amendment? What does it protect and what doesn't it protect?
Well, I can't answer that question because nobody really knows. So the Heller case really was a very narrow case. And so Heller was the big Supreme Court case, and then McDonald was the follow-up to say essentially that the right is a fundamental one that is held against state laws as well. But essentially it said at the core of it, there is an individual right to own guns, and at the core of that right is protecting yourself, self-defense in the home. The problem is right, people have guns elsewhere. And so then what does that mean for public carry, for things like that? What types of guns are you allowed to own, then protect yourself in the home? What types of, magazines? And the case doesn't address that at all. And the Supreme Court has been completely unwilling to take any of these other lower cases that could address these questions. There are different theories on why that is. But so as of right now, the Second Amendment means you have a right to own a gun for self-defense in your home. What else it means is frankly a little uncertain, and probably different in different parts of the country, depending on what the circuit courts have said.
If I can just bring in, Harold, you had said a minute ago, it's too bad we don't have somebody from the other perspective. Mm-hmm. So I would actually like to bring in somebody from the furthest possible perspective on the Second Amendment. And that is, I mean, who is the most strictest constructionist that you've ever heard of in the Supreme Court? And that would be Judge Scalia. And he's not here to speak for himself, so I'm going to speak for him. But in his words, I'm quoting him directly because it would not be right to take his words out of context or change them. But this is, quote, word for word what he said. And his opinion on this issue, I think it's important that we all know. This is the most extreme possible position on the other side. And he says that the right secured by the Second Amendment is not unlimited. And he said that commentators in courts have explained that the right is not a right to keep and carry any weapon whatsoever in any manner whatsoever and for whatever purpose. And then he went on to say, nothing in our opinion should be taken to cast doubt on longstanding prohibitions on the possession of firearms by felons, by the mentally ill, forbidding the carrying of firearms in sensitive places like schools, government buildings, or laws imposing conditions and qualifications on the sale of firearms. So I just wanted to add Justice Scalia's opinion.
Yeah. Mike, how would you respond to that?
So that's been part of the problem, right? Is there appears to be some inconsistencies within Scalia's own opinion. He says this is a fundamental constitutional right, but if you want to ban felons, you know, even if they have been convicted of a nonviolent crime, or if you want to ban the mentally ill for their entire life, that's fine. We just accept that. And it's unclear why that is, right? He doesn't explain why. If this is a fundamental constitutional right, the default should be everyone has that right, and you have a burden then as a state to say why they shouldn't have that. And so different courts have looked at those bans that have been accepted differently to say, well, you know, what did he mean? Maybe he meant the mentally ill only if you have severe mental illness, right? So somebody with depression or somebody who voluntarily committed themselves at some point, should they not be allowed to the rest of their lives? And again, the courts right now are kind of all over the place with figuring that out.
Yeah, thank you. Right here.
Hi, so I'm Erica Townsend. I am an employee here in Student Affairs and have worked in Student Affairs for about 7 years. So I wanted to go back to having, you know, guns on campus and guns in schools because I am in that camp that we should not arm teachers. And as someone who's been an educator, I pretty much agree with every public education group out there that also agrees that we should not arm teachers despite the current, you know, discussion around that. Is there something that we can do as educators? Again, is it mental health resources? Is it something where we have to be trained to be first responders? You know, there's so much responsibility on us as educators to keep our schools safe. What is your opinion on how we can better protect our students in schools?
Well, I have an opinion.
Okay.
I think the best way you can do it is picking up the phone in a half hour and calling your representative and telling them to pass gun laws. Teachers' jobs is to teach. And what you should be spending your time doing as an educator is educating. And there's absolutely no reason why you should be spending a minute of your time trying to figure out how to protect students. That should not be your responsibility. And so what we need is for our policymakers, for our elected officials to protect our kids. It's not the job of teachers and educators, and it should not, you know, it should not be their role, period.
David?
Yeah, I think this is a great question. Thank you. And I think it really speaks to the challenge here where there's sort of in this culture an idea that the solution to bad people with guns is to make sure more good people have guns in situations. And it's one that doesn't make sense to me, and I don't think the research supports it. But as I think about this mindset, I think about a conversation I had with someone in Mississippi where we went to dinner at this restaurant. I told them a story that the last time I was at this restaurant, right around the corner while I was sitting there, 2 young men robbed a grocery store and they shot a cop. So I was sort of telling the story as I'm getting ready to walk to my hotel a couple blocks away. And he said, you know, he's a white man, sort of my age, said, do you want me to walk with you? I'm packing. I can protect you. And I said, no, thank you. But we use that as a chance to talk through, and I asked him, under what scenario do you think that would go well? If we were being robbed and you pulled out a gun. Like, how does that not just automatically escalate a situation? And he felt confident. He says he's never had to use it. He hopes he never has to use it. But it's hard for me to imagine that it just doesn't dramatically escalate a situation. You bring that into schools, and it's hard for me to imagine it goes well. Yesterday in California, I read a story about a teacher accidentally shooting a gun, hit the ceiling, and some debris injured a student. I mean, it makes no sense to me.
Zameen, did I see your?
No, I just want to say something about that. Using fear to drive and profit from people's fear is one of the techniques that the industry often use. Having more gun is not going to solve the problem. And I think, we talk about the Second Amendment, but then a less debatable issue is whether we should keep guns out of the hands of minors. And there is a lot of inconsistency even at the federal level, the extent to which the even licensed gun dealer can sell shotgun versus long guns. So there is age 21 age limit for a licensed dealer to sell handguns, but in terms of long guns, such as rifle or shotguns, that's age 18. And then for private, there's no age requirement for rifle. So it's really shocking to see this inconsistency with respect to gun ownership, even for minor. So I think in terms of legislation, there is a lot of work even at the federal level. So this is one of the lists that we put out there, probably in your hand, to call your legislator. I think that's definitely less debatable in terms of having guns in the hands of a minor.
And if I may reiterate, the legislator doesn't know unless you call and unless you let them know this is not something that we want or this is something that we want, because it happened all the time in our office. On the receiving end and receiving all these phone calls, we would tally, these many people don't want the legislator to vote this way or that way. And in a responsible office, we felt like it was our job to tally the people who vote, right? And then let the legislator know people don't want that or people do want that. So exactly what you said, it does make a difference when you call and you say, as an educator, I do not want this, and 200 plus other educators don't want it either. And when you are able to do that in masses, that's when legislators pay attention, yeah.
Thank you. And we're going to have an exercise in doing exactly that very thing in just a few moments. I see a hand in the back.
Hi, I'm Jessie, Center for Health Law, Ethics, and Human Rights. I don't have a question for you, Ulrich. So I actually have two questions. One is an echo chamber question, and the other one is not an echo chamber question. So the echo chamber question is, I wonder if we as a school, not right in this moment, but maybe as a sort of like thinking project, if we can get on the same page about what we actually mean about gun control, gun reform, gun safety. We kind of throw these terms around interchangeably, and I think that the message gets sort of lost because we're not using consistent language and we don't have a consistent message other than guns are bad. So that's the echo chamber question. And then the non-echo chamber question is, how can we actually get outside of our echo chamber? Because all the stuff that's coming up today, I feel like I'm hearing it over and over and over again. Every time there's a mass shooting, it's kind of the same stuff that comes up that people who are in this room feel frustrated about. And then people who are not in this room don't seem to have an issue with. I was watching something that Wayne LaPierre said shortly after the shooting in Florida. Wayne LaPierre is the mouthpiece of the NRA. And one of the things that he was saying, he was at the CPAC thing. One of the things that he was saying was that the gun control laws that we currently have on the books do not get enforced. And so we don't need more laws, we just need better enforcement of current laws. I have no expertise in this, so I have no idea if what he's saying is true or not. He was using the specific point that people who are convicted felons that should not be able to legally purchase a gun, that states that are obligated to tell this sort of national database were not actually doing this reporting, and so these people were getting guns even though they shouldn't have been getting guns, and it was the fault of the people who were supposed to report. Again, I have no idea if that's true or not, but I think that it would be useful if we could find out more information about those kinds of things that don't really appear in the conversation quite so often. And I think we could achieve that if we brought somebody from, I mean, the NRA has a Massachusetts chapter, so maybe we bring them here, or maybe we go to them, or maybe we go to Smith & Wesson. But we do have folks in our state, even though this is a great state for gun safety stuff, there are ways that we can sort of reach across the aisle here and have conversations here in our own state about ways that we can conceive of gun control, gun safety, and all of that.
So you've said a number of things, and let me see if I can frame this into kind of a question for us. One of the things that you've mentioned is how we use language, and that language may mean different things to different people. But one of the other pieces that you've raised is the issue of how do we take our conversation to the next level? How do we go beyond where we are right now? And maybe that's the question that I'll ask to our panelists. As we think about, we repeat many of the same kinds of things over and over each time there is a conversation. And so the question is, how do we take this conversation to the next level?
Well,
Mike, I see you leaning.
Yeah. I think that it's important to get the NRA perspective. So I'd like to give you the NRA perspective. And again, I'm quoting. This is not my perception of their perspective. This is their perspective. And this is actually from yesterday, quoting from the NRA yesterday. And here's their statement of what they support. And I'm sorry to say this, but I actually agree with them. And here's what they say. They say, we support, what do they support? Quote, efforts to prevent those who are a danger to themselves or others from getting access to firearms. And if I had to summarize the public health perspective to firearm regulation, it would be that what we're trying to do is to prevent people who are a danger to themselves or others from getting access to firearms. So what I want to suggest is that there is no debate here. There's no debate. Everybody agrees, even the NRA agrees, that in the principle that we should prevent people who are a danger to themselves or others from getting access to firearms. The problem is that nobody is able or willing to just come out and say that what the NRA is telling you is complete BS. It is a BS organization. And the reason why Emma Gonzalez is my hero is because she was the first person who I heard say, I call BS on you. And frankly, that's what we need to do. We just need to call BS on the NRA because it's complete garbage what they're saying. They are basically articulating the exact same principle that we all agree in. There is no debate. So I think that the step, that what I think we need to do to move forward is basically to, what I do when I advocate for these policies is everything I say comes from NRA quotes. And so when I'm done, any kind of problems that they have with my testimony, I just say, well, don't ask me, ask the NRA. This is what they're saying. So I think that really this way to move forward is to just delegitimize that organization. And that's what we did with tobacco, and that's what made the difference, is we were willing to stand up to the tobacco industry. We completely delegitimized the industry, and that's what really made the difference.
Michael?
Yeah, I think another way to move this forward is when these things happen, and going along with that NRA quote, what they push is, law-abiding citizens with guns is fine, right? And so what this has really turned into is it's violent people or the mentally ill. And while I would love more resources available to deal with mental health and mental illness, it's really creating a scapegoat to where they can say that's who is to blame. But plenty of people are law-abiding and not seen as mentally ill until they pull a trigger, right? And so when we're looking for similarities with tobacco, we need to recognize that guns are inherently dangerous, just like cigarettes were inherently dangerous, right? And so there's ways to minimize that, and so that's part of the public health perspective, is how do we minimize the harm of these things if they're going to remain legal? But also, I think, a recognition that they are inherently dangerous for anyone that has them, whether they be law-abiding, not mentally ill, or whatever. And I think we really need to push back against this idea that mental illness is what is the cause of all of these problems. Because I think in the end, if they're able to control that narrative, then it's going to make it more difficult to tackle gun violence.
Let's come right back here. Yeah. Okay. Great.
Okay, sorry, I wasn't sure where you were pointing. Hi, my name's Jillian. I have a question to also kind of echo the Jesse's point. So I feel like the movement is really powerful, and I commend the students for bringing it up. And I think that the School of Public Health or the School of Medicine campus is doing a great job of doing that. But I feel like it's a very narrow frame of what we're talking about in terms of gun violence, because I feel like a lot of the issues that we're talking about right now are specifically about mass shootings for students, when there's been a lot of gun violence in terms of structural police violence towards black and brown bodies, and also in general, like the structural like trafficking of guns to other countries that the United States kind of participates in, unfortunately, and causes more gun violence. So do you think that this narrow frame is taking away from these issues that have been there? Emma Gonzalez is a great person, but I don't think she's the first person to call BS on the NRA, but I do believe that she might be one of the first few people that the media has paid attention to in saying it. So do you think that takes away from what research can point to, and we're only going to look at mass shootings towards students, or do you think there's still time to be able to look at a broader perspective of the ultimate like structural issues of gun violence and not just those policies?
So the question is, how broad are we too narrow in our frame?
Yeah, I mean, so the way I look at it is, you know, and I sort of deliberately framed my opening comments not in terms of mass shootings, but in terms of the Mississippi Delta and sort of chronic day-to-day living. I often think about political science framework that talks about when a window of opportunity develops to make major policy change. You need to have consensus on what the problem is, consensus on what the solutions could be, and a political moment. And I think, you know, I'm not convinced that there's consensus right now as a country on what the problem is, partly for the reasons you described. I think we have solutions to lots of different kinds of problems, but I think what the mass shooting really does is it creates a political moment that allows a conversation for all those other things. So no, I think it'd be a mistake to keep the conversation super narrow, but I think that is what gives us this political moment. It's why we're sitting on the stage now as opposed to another time, I imagine.
So this raises the question of what do we do, and what are the kinds of actions that we can take right now? Would you please pass out the document, please? So what I'd like to talk a little bit about is, so what is it that you can do? And one of the things that we often talk about is the importance of making calls to legislators or sending emails to legislators to express an opinion. And first, I want to turn to Valentina and talk about, so what is it like for you working in a legislator's office and receiving information from constituents?
Sure. So I think I was talking to Professor Jones about this right before we started. It really depends on who's staffing the office and where you are calling. Some people will likely answer and be very courteous, and if you have questions, they'll have answers. Others will maybe just say, thank you for calling, we'll tally you and let the legislator know, and then others just won't answer. From my experience, I worked for a very young legislator who was willing to take in everything that her constituents were looking to change. So in that sense, it really, again, just depends on the level and who you're calling and what you're calling about. And at this point, even after talking to some of my colleagues, both at the state level and the federal level, are saying, and they are very much prepared to receive these phone calls, and they know, and they're tallying, and I'm sure that they're ready to give you answers, but if they're not, they are significantly taking in everything and letting the legislator know, you're going to lose votes if we don't go this way or that way.
So a question to you, and this is by show of hands. How many of you have ever made a telephone call to a legislator to say, I want you to do X? Excellent. I'm glad to see that. Well, you're going to have another chance to do that right now. Because what we've given you is a script. And this is a script for calling a legislator. And let me explain what's on the script. And then we're going to actually attempt to make telephone calls right now in this room today. So what this script says is, it gives some, the first paragraph is, I'm whoever you are, and that you live at X place. The second group, you see there are 7 items there. We've identified a number of issues that our panelists consider to be some of the important issues that legislators should be hearing about, federal legislators should be hearing about. On a state level, states are very different, and each state is doing something slightly different. But on a federal level, these are the things that we would like for people to hear about. You're going to choose one of these. Not all of them. You're going to choose one of them. And then down at the bottom, there's a closing. It says, these measures are important to reduce gun violence in our home, and I want you to know that I'm interested in this issue. And then at the very bottom, there's an opportunity for you to give us some feedback about what you did. So let me walk through this again. The first is who I am. My name is Harold Cox. And I want my senator, Senator Warren, to make certain that she does not support concealed carry, reciprocity act. Thank you very much. I want her to know that I'm really interested in issues around guns. It's as simple as that. And so we've given you at the very top of this sheet information about how to find the contact information for your representative. So on your smartphones, you can put in whoismyrepresentative.com, and it will actually tell you who is your legislator. And in particular for this exercise, we're interested in you talking to your federal legislator. So it's either your representative or your senator. So you've got 2 senators and you've got 1 representative. You're going to pick one of them. You're going to call them on the telephone. And who are they going to talk to? Who answers the telephone?
Likely at this level, the secretary may be the first person to answer, and if they are able to transfer you over to one of the aides, you might be speaking to a legislative aide. If not, then you will be speaking to likely the secretary. So
you may not get a chance to speak to the aide. You definitely will not have a chance to speak to the representative or to the congressperson. However, what we're going to attempt to do is to actually make telephone calls. We talk about doing this kind of thing all the time. We talk about the importance of making calls to our legislators, and people say that's a great idea. I was so encouraged to see the number of you who have actually done that, but now we want you to actually do it in this room while we're sitting here. So you are going to, I'll answer questions just a sec. So you're going to tell them who you are, you're going to pick one of these items, you're going to close the conversation, and then you're going to tear off this end of the piece of paper and give that back to us. You're going to leave it at the front as you are leaving here. All right, there was a question. Yes? A microphone? Well, because we're recording, it would be good for us to have a microphone.
One of the last times that I called, there was kind of like an organizing that was going on behalf of the School of Medicine here, on behalf of the MDs, and it was for single-payer healthcare. Now, I called Congressman Capuano's office, and whoever picked up was extremely rude and asked me if I had done my research and looked up where his position was, and was pretty much told that I was irresponsible and that we were being annoying by making so many calls. So when you experience something of this sort, what is your advice?
How would you respond to that? If someone called you and said, why are you calling me?
Well, I wouldn't do that. But,
oh, you would not do that, okay.
You know, you thank them for your time, for their time, and if you know whether or not you'll vote for them, I think that that's also a way to go about it. Like, well, you know what? I would like to, either you can ask for a superior, let them know how you're going to vote, maybe even, and they might change their attitude. Or you can even send an email. Emails go a long way as well, especially because the emails are going to go to the legislator and the legislative aide. So at some point, and no legislator wants their constituents to be treated poorly, right? Because that's a vote. So that's the way that I would go about it. I never did that in my office.
So it would be important for you, if someone responded to you in that way, you may want to say, I would like for you to remind you, I really do vote for Representative Capuano, and I will have to consider whether I'll continue to do that if you're not able to assist me with my question. Mike, David.
Yeah, so I think if Representative Capuano has a staff member who's being rude, it's a huge mistake, right? Because he has a pretty serious primary challenge right now. So I've been on the other end of these calls too in different offices, and every office treats it very differently. Some just kind of ignore them, some really tally them. But one last comment I want to make sort of as a closing thing, if I can, sort of what happens beyond this. I think the Tea Party is in some ways the model. The early days of the Tea Party is the model for how to impact the policymaking process. I've interviewed lots of Tea Party leaders across the country, and I didn't usually agree with them, but I was incredibly impressed by their dedication. They found out when their representatives at the state level, the city level, the federal level were having coffee hour, and they went to the coffee shop and they sat face to face with their representatives. They went to the State of the State speech. They went to every legislative hearing. I mean, they made a very small number of people made themselves a presence in the policymaking process. And 10 people showing up at a hearing that usually has 2 people showing up might not seem like a lot, but it has a huge impact. So that's sort of the biggest encouragement, I think, if we want to make a difference. It's really insert ourselves in the policy process.
Any other questions about the assignment that you have, which you're going to do right now? All right. So I'm wondering, from the perspective of our panelists, if there's one of you who has the answer. So there's a big question here around, so what are we going to do? And I'm wondering if any of you has an idea of kind of, so if I rule the world, this is what I would do.
I'm going to defer to that.
Michael, I think that they're looking, I think Mike, they are looking to you. I see all the panelists kind of looking at you as the sage.
So is this question in terms of policy?
In terms of policy, in terms of addressing this issue around gun violence, of addressing the larger issue that we are dealing with right now.
So I think that my experience is that 20 or 30 years ago, when we started fighting the tobacco industry, everybody said, they're so powerful, they control Congress, there's no way you can beat them. They put out all this misinformation. They control the frames. They have immunity from litigation. You'll never win. And we weren't discouraged. We despite the odds against us, we continued to fight and to just use the basic tactics of grassroots advocacy. I mean, Advocacy 101, the basic principles that we teach actually here in the School of Public Health. And just to keep fighting and not give up. I think that's the biggest thing, is that I think that what the students have done is remarkable, and I really think it is a change. I think it's a meaningful and substantial change in that they've been willing to stand up to the NRA. They've kind of made it okay to do that. And so I think we just need to keep building from that and using basic advocacy. I don't think we need to look at this somehow differently and say, well, this is different because they're much stronger. I mean, we said the same thing about the tobacco industry, and look at them now. And I think one day, hopefully not too long from now, we'll look at the firearm industry and the NRA in the same way and say, 20 years ago, or maybe only 5 years ago, the NRA used to be this organization that everybody said, oh my God, we can't defeat them. And we know we can do that. I know we can do it because I've seen it in my lifetime.
Yeah. A difference can be made. You're going to hang out here for a few moments and do your assignment, and then you're going to rip off the piece of paper and let us know what you did so that we have some sense about that. But before you do that, please thank our panelists. make those telephone calls. We're going to hang out here for a little bit, and we want to know how it worked out for you.